You're welcome once again to the African Nutrition Society podcast. We've been discussing school health and nutrition, and we've also discussed food systems and food security during the African Nutrition Conference. And today I have with me a very special woman. We celebrated her yesterday because it was her birthday, and it was really nice. I'd like to give you a little bit about her. Dr. Habiba Hassan-Wassef is an expert in nutrition and health policy with extensive experience in research and policy development through her work with organizations such as the World Health Organization. Her expertise spans across nutrition, public health, and link between food systems and well-being, especially in Middle Eastern and African regions. She also serves as a trustee of the African Nutrition Society and is a laureate of numerous international awards. Mom, you are very welcome.
Thank you.
So how does it feel, and what are your impressions of the whole conference that has been going on from pre-conference school health and nutrition workshop through to the African Nutrition Conference?
No, it's not, of course, the first Nutrition Society conference that I attend. I've attended many since 2008.
Right.
But what I can comment is that each time the African Nutrition Society has a conference, they are really presenting all what is new and what is advancement in the science of nutrition in Africa and in the world.
Awesome.
So this, I find that this conference is, because it hasn't finished, very rich in the material and the content that it is presenting. Right. And then there is active also participation of the audience, which is a pleasure to witness.
Right. And so we encourage all our viewers and our listeners to try and get these updates from our social media handles. So Mom, you were with us during the pre-conference school health and nutrition, and we discussed practical approaches to improving school health and nutrition. And so I would like to ask about your opinion on how we can optimize nutrition programs, that school-based nutrition programs, in order to address the double disease burden, especially while we are talking about malnutrition, basically undernutrition, and also obesity, which we're also having challenges with.
My reply may not satisfy you because all the causes of obesity and malnutrition are not in the school. It is outside the school.
Okay.
So, and the school doesn't have much control on that.
Okay.
But there are conditions because the school meal or the school menu or whatever they do offer in the school will not affect the obesity of a child.
The entire prevalence.
But what can the school environment give to impact on the obesity?
Okay.
Now, in many schools in my country, Egypt, you have what is called the school canteen, and it is not very much controlled. And what is sold in that school canteen, like crunchies and chips and all sort of fried and salty foods, and soda drinks full of synthetic sweetener and synthetic color, this can lead to obesity. So it is not the school meal that causes the obesity, but what happens in the school or even outside the school wall with all the vendors that they sell to the children, food that can increase their obesity. You see? So it is not the school meal itself, but what can happen inside the school or outside the school or in the home.
We understand that. But I think we've had interviews with some speakers as well, and we talked about the importance of inculcating good habits, because most children are going to school. And so as part of the school feeding programs, the goal is also to inculcate healthy eating habits and practices in the children, so that if they have the right information, they can practice themselves when they go homes, they can share with their friends and their families as well. So my question is, although you've talked about the fact that school meals are not the way to, because the environment, we need to consider the environment as well. Do you think that the school program can also, in a way, contribute to resolving some of these issues we have with nutrition and health?
Very much so. Very much so. Because you have to, the children have to understand the meaning of a healthy diet,
Right.
what are healthy foods and what are unhealthy foods. But I can tell you, and the school meal itself is a practical example of what is being told. So it should be balanced, it should be healthy. But what happens is that the attraction and the demand for all those crunches that has become a habit. I mean, somebody in the conference said that it's a crime to have all those snacks inside the school. Crime inside the school. You see? So this snacking habit has taken hold of the children, unfortunately. So you have to sort of fight against it and educate the children, give them the information, because finally the final choice of what they will buy and consume is in their hands. You can only advise.
And I'm happy that you talked about the food environment, so that if we have a healthy environment, then the options for the children are limited to healthier options. And so if the schools, I like that we're saying that it's a crime. So what role does the school as an organization ensure that the environment is healthy? What role does policymakers or the governments, let's say, if it's Ghana, we are looking at the Ghana Education Service, the Ghana Health Service, working together. We've talked about multi-sectoral collaborations. How can they work together to make sure that the environment is healthy, so that when children have to choose snacks, they're either going to choose, let's say, an orange, some bananas, instead of choosing the fried foods that you talked about?
When you say fruits and bananas, that would take place outside the school, because school meals do not often serve fruits and vegetables. And this was stated in many of the reports and the studies in the conference.
Right.
So those healthy foods, vegetables and bananas, it's not easy. There are some barriers, whether even if the availability of fruits and vegetables outside in their homes, that children do not like vegetables.
True.
You see? And fruits now, with all the increase in food prices, fruits have become quite expensive, except if they are national fruits. I suppose bananas are still cheap here. But in my country, the cost of fruit now has become prohibitive. Many families stopped eating fruit because they can't buy them. You see? So it is economic factor. I mean, you can educate, but
the
you need to
resources
pay.
are not there
You need to pay.
to assess.
You need to pay. And the issue of fruits and vegetables is a challenge that we haven't yet solved in school feeding programs.
So what is the way forward?
For
way forward, because we are advocating for
the
healthy
way
eating,
forward.
and we know that for a balanced meal, we need to include fruits and vegetables to our staples. Our legumes are also becoming expensive, animal source foods and all that. So what is the way forward for us? If you're teaching children healthy habits, if we say we are inculcating healthy habits, we've talked about nutrition and agric linkages. As a people, and even as policymakers, as stakeholders, what is the way forward for us to ensure that?
Tell you something. First of all, we are talking in a general perspective, which is not correct.
Okay.
Even in my country, which has a central school feeding program that relies on a snack, on a baked snack that has a filling of dates.
Okay.
Dates are very rich and they are fortified with micronutrients so that they do give quite an appreciable support. It's not all the requirements, not 30% of the requirements that it's supposed to give to a child, but quite high. But other than that, we have schools that have a full cooked meal, you see? So we don't generalize. A full cooked meal with vegetables, proteins, and carbohydrates, and a fruit, you see? So I don't think we can generalize and say, but it is the capacities and the resources local in every context or every situation that governs how much is given. But the ideal meal is still governed, not maybe across the board in all schools, but there are good examples. There are good examples in every country, because there may be a school that is sponsored by a civil society organization. For instance, we have a civil society organization that is feeding a hot meal to over nearly 4,000 students every day, and the whole school year, you see? So they are privileged, while at the same time the national food nutrition, school feeding program does not really give all the 30% of the needs for children.
Right. So in what ways do you think we can tailor nutrition education to address the diverse nutritional needs of children from different socioeconomic backgrounds?
Nutrition education in schools or for the family?
We can talk about it in different contexts.
Because actually the students or the pupils, because they are mostly, the focus really is on the primary school, less than the adolescents. Nutrition education, they don't have the power to change or to bring much change in what they consume. Well, if it's the home meal, it's the mothers and the home meal. If it's what they buy, then they always buy the wrong thing. And if you want to educate them not to buy the snacks, they will not obey you because they love the snacks, you see? So nutrition education has a limitation if it is not supported by a healthy environment and the capacity, the means to obtain and to consume that amount, which is mostly economic and availability.
Right.
So it's the availability, the affordability of the healthy food.
A healthy environment and the capacity, that's really good. So when we talk about environment, we're looking at how, we usually look at how governments can support, how policies can support some of these interventions. So what policy changes, as part of your final words, what policy changes would you recommend to ensure school health programs are sustainable and impactful in long term?
First of all, I go to your last word, which is sustainable, which depends on budget. So in the pre-conference survey, there was a question, does the national budget support your national nutrition program or not? So the national budget has other priorities, and they don't give that much to nutrition, to the school feeding, you see? Right. But we can use more budget and more economic resources. And so the policy would be to provide financial resources for the school feeding. It's a policy decision. Do they do that? Not everyone, because there are other priorities. The other policy is to respect the 30% of nutritional needs. The school meal should provide the child with 30%. This also depends on resources. The issue of homegrown gardens or homegrown school feeding, it still has a cost, you see. It isn't that because you say the magic word homegrown, then you just take the homegrown and put it on your plate. You see, it is quite complicated. But homegrown means that you use local production to local food supplies for your school feeding program. That is the interpretation of homegrown, which means the procurement for the school feeding program should be from local resources.
Right.
So that, to me, is the real interpretation of homegrown. But it isn't that if you have in a rural area that all what you need for the school is actually local here, but you may have procurement. So the policy would be, which we discussed more than once, is for at least, the policy should have at least a percentage, to give a percentage of the school meal is prepared from local procurement. That would be a policy.
Right. Thank you very much, ma'am, for the insights that you have shared. So we are minding our food environments, we are minding our budgets.
The school food environment.
The school food environment. We are also looking at our budgets and looking at ways that we'll be able to have a balanced meal as much as possible. We understand the challenge that resource poor communities may be having, and so we're also entreating policies that are favorable to improve the food environment.
Can I add something?
Please go ahead.
Yeah, we mustn't forget the role of the private sector. We can have partnership with the private sector. A lot of them are ready, especially through their social responsibility funds, because they're supposed to give a certain percentage of their income to social development programs, and the civil society.
Definitely.
They are the big supporters of the government in improving the school feeding programs.
Public-private partnerships. Thank you very much. This has been the African Nutrition Society podcast. You've heard it for yourself. Please leave your comments in the chats. Many thanks to our sponsors, especially Catholic Relief Services, who have made these interviews or engagements possible. See you next time.